health insurance is the reality. You know, it's the future, and I believe it's the only way to go. You know, especially when we're talking about universal health coverage. I'm happy to see that things are now being, the state is taking over to manage health in their respective states. And I think it's a good thing that they're working with the HMOs because, they have the experience, like Dr. Adenusi said, and I'm really hoping for the best.
Well, just to say that I'd like to reinforce what Dr. Awishika said. Health insurance is the tool to achieving, a major tool that is available to us as a country, as a state, in achieving universal health coverage. All stakeholders, the people, our providers, the HMOs, regulators, I think our roles are well defined, at least as it relates to Lagos State Health Scheme. We need to come together. It's an interdependent program and implementation to ensure that everyone, particularly that man, that woman out there on the street, the underserved and unserved, come on board the scheme.
Thank you very much, ma'am.
With an eye to universal health coverage, I'd like to observe that health insurance is not the silver bullet. Health insurance is just one leg that will get us to universal health coverage. And I would like to thank Farm Access and similar organizations for what they've done to bring health insurance to where it is in Nigeria today. They've been in there since democracy began, or perhaps even before that. But I would like to encourage them to please lobby governments at all levels on the matter of preventive care. Today, perhaps 20 to 30% of us in this room carry the sickle cell trait. In the general population, that means that 6% of newborns or thereabouts have sickle cell anemia. Sickle cell anemia causes a disproportionate burden. In fact, many of the under 5 deaths, or a disproportionate number of under 5 deaths in Nigeria, are because of sickle cell anemia. The genetic testing required to determine whether one is a carrier or not costs under 1,000 naira.
It is indeed an honor to be here. I thank the organizers of this event for the opportunity given to me to address fellow professionals in the health sector. As actors in the health sector, I am certain that this event will boost our drive to transform the health sector. The theme for the event, Healthcare in Nigeria, Transformative Solutions, is apt and timely. The transformation of healthcare in Nigeria is a collective effort. We must join hands together as individuals, organizations, government, NGOs, and development partners to ensure that we have an effectively and efficient healthcare delivery system. We cannot undermine the importance of good health to the development of any nation. Health is wealth. It is only a man that is healthy that can think, innovate, and work effectively. A bad healthcare system kills talents, innovation, and precious lives. We cannot be serious about developing our economy without according befitting considerations to better healthcare systems. As a responsible custodian of healthcare delivery in Nigeria, we must ensure excellent strength is accorded healthcare that is available and affordable. Our hospitals must be equipped with required drugs and effective laboratory for proper diagnosis. Continuous training of medical professionals cannot be overemphasized. We have a moral right to provide basic health care for our people. In Lagos, the present administration is definite on the importance of health care. Health and environment is at the heart of policy structure tagged themes towards a greater Lagos. I must add that we cannot be talking about the transformation of healthcare without due application of information technology to healthcare delivery. You will agree with me that today's doctors are increasingly young and versatile, especially in the application of digital skills. Such skills must be applied in the delivery of healthcare services. The world is now talking about telemedicine, telehealth, which allows patients and doctors to communicate at remote distance. It will reduce travel time as well as pressure on our doctors. It is increasingly crystal that dynamic application of technology will boost healthcare industry. I trust the speakers for today will do justice to the subject matter, and we will all leave here better informed and return to our various health posts to implement the desired transformative solutions in healthcare delivery. It is therefore my pleasure to declare the exhibition for this conference open to the upliftment of healthcare delivery in Nigeria.
Next slide. When we think about the workplace and mental health, for us as practitioners, for us as maybe business owners, we need to see that it's linked to the bottom line, whether we like it or not. Whether your organization is making the profit it needs, it is linked intricately to the issues of mental health in the workplace. And there are lots of research and studies out there showing us the import of this. By 2020, depression will rank only second to heart disease. So all the hypertension, cardiac disease that we're running about and taking as priority, by 2020, depression will just be next to it. And we have to pay attention. We need to tackle it. We need to realize that our workers, employees, and co-workers are struggling with this burden of depression and mental ill health. Mental illness is also associated with high levels of presenteeism. We're familiar with absenteeism, right? We do have people that bring presenteeism to work. They are present in the workplace, but they are not productive because they are depressed, they are anxious, they are not sleeping well, they have suicidal ideas, and this is affecting their productivity. 1 in 5 people in the workplace experience a mental health condition. And unfortunately, things like stigma, discrimination, and lack of awareness makes it hard for people that struggle to come out. If we check ourselves, we in this room may have contributed to the stigma one way or the other, because we're in a culture where there's a lot of stigma about mental health. I want to charge us as we're thinking about, universal health coverage, to be among the advocates that are going to try and destigmatize mental health. Make people feel free to come out and seek for help. Make your organization such that people that are struggling find it safe to be able to ask for support and assistance.
This year, we decided that it was important, instead of just having conversations alone about the different elements of care, all right, to discuss the place of health insurance specifically and private health insurance, because it's something, it's what you call the elephant in the room. All right, everybody loves it, and then people hate it, and people don't sometimes know what to do with it, and yet it's something that you need to understand because of its implication for us as a society and the people. Next slide. So what's the point of it? The point of health insurance really is about removing the conversation about payment from the discussion when we're talking about access to care. That's really what it is in summary. The patient need not worry about how they're going to pay for care when they need it, and the physician need not worry about if they will get paid at the time they have to render care. So that the entirety of the conversation is about the care that is being given and its quality. The better we are able to deliver this conversation, i.e. the health insurance, the easier it is for everyone to get closer, or for us as a nation to get closer to universal health care. Next slide. So imagine this discussion, all right? Yes, cartoon, the guy is enjoying himself supposedly and then tells the physician, I can't pay. What's he supposed to do? Switch off the machine, kick him out of his room, but he admitted him in an emergency. Now you can't, these are real life issues that physicians face in their hospitals because they've taken people in and people don't actually either want to or are not able to pay. And these are some of the situations that health insurance seeks to resolve. Next slide. But the main issues around health insurance is finding a balance between two sets of competing challenges. One is the customer expectation, all right, and here the customer might be the private paying person, it might be the government paying, it might be a corporation, an institution paying for someone, whoever that sponsor is, has issues around expectations, about convenience, expectations about the transparency, expectations about responsiveness when care is required, and expectations about affordability as a whole. Because you might think that a corporation has so much money, but when they multiply the premium per head by their population, all of a sudden the numbers become very dizzying and it's no longer affordable to them. So they want the totality of the cost to them to be affordable. And you've got to balance that with systemic issues around fraud, around abuse, around information asymmetry, and those things, we must find a balance in addressing them so that we can get sustainability into the system.
That the rate at which we hear of suicides, of depression, and the likes has multiplied. And it's one of those things where, if you think about the fact that sickle cell anemia afflicts 20% of the black population, all right, you can imagine that something with noise greater than sickle cell anemia must be afflicting many more people. And the fact that a lot of people feel that there's a stigma around mental health means that even the thing that you see is probably just the tip of the iceberg. The reason why we did this conference, last year we also had a panel on mental health. But when we looked at that panel's performance, as well as the follow-on incidences in the country, all right, we decided that we should make it the focus condition for this year. And the subsequent panels on this year's conference will also be addressing that. One of the points that we wanted to also highlight is the fact that on our plans at HMO, we do offer cover for mental health issues. So it's not that someone just requires physical health arrangement, but it is a challenge on a mental health level that's also covered in the plans that we provide as HMO. But certainly there's a lot of attention, and we think that the awareness that we bring through this year's conference will help to support people's understanding and destigmatization of the mental health situation. So part of what we must do as a society is to be sure that we're not allocating resources to people who can afford to pay by themselves. We should be allocating resources to people who cannot afford to pay. And what that means is that those people who are better off can buy their own plans for their own cover, so the government is allocating its resources to the people who cannot afford and rural areas. People are already attracted to urban areas where you have the better facilities, the better support, the better infrastructure and all that. So let those ones even be the ones that are paying for private plans. In the rural areas, the government support can then head there for people who have not yet come out of that place where they have fewer resources. So we can try to allocate private resources to people who can afford to pay that, and public resources to people who cannot afford to pay.
It's important that we in the health sector are able to put aside our differences and sit down and begin to explore ways that we can come together to solve these issues.
And for the rural areas, it is quite difficult to have better or good medical attention for those in the bottom of this pyramid. Now, is it a finance challenge, or what could be the challenge why doctors or medical professionals are not going to the rural areas?
I stand corrected in that, because you see, one of the things we've understood from the interventions we've done at the Farm Access Foundation is that if enough incentive is provided for these people to go to these areas, then they will go. And when I talk about incentives, I don't mean doing anything special. Just ensure that if services are provided in these areas, they will be paid for. And so one of the issues that happens is that Nigeria still sees health as an expense. Healthcare must be seen as a business. It can no longer be seen as a social service, because government cannot pay for healthcare. And that is the problem, because government keeps saying it wants to pay for healthcare, has the inability to do it, and so creates a disincentive for people to go to the rural areas to provide these services. However, if they are aware that once they go to these areas and they provide these services, there will be payments for those services that have been provided, I guarantee you that doctors will go to the rural areas and provide these services.